Hey all, just a quick podcast here to go over some basic things on chest x-ray. This one's going to concentrate on line placement, intubation, and pneumothorax. So hope you enjoy it. So again, just real quick with the principles, make sure you have a systematic approach. Even if you're someone who doesn't read chest x-rays a lot, make sure you go through the whole ABCDE method to interpret chest x-rays just so you don't miss anything. It's easy to find one thing and miss other things, or it's easy to place a line in a patient and just look at the line and nothing else and then miss something. Make sure you compare with previous chest x-rays. That's really important. It makes it easy to pick things out. Again, the goals with this are going to be simply line placement, pneumothorax, and endotracheal tube placement. And a couple of other interesting things I've added. So the ABCDE approach, A for airway, B bones and soft tissue, C cardiac and mediastinum, D for diaphragm, and E for everything else. Look for lines, tubes, effusions, lung fields, etc. Just real quick on if you get a poor x-ray and you're looking to find the carina to judge placement of a line or an endotracheal tube, this is one way of doing this by counting the ribs and thoracic vertebrae. You can find approximately where the carina is. You can see here, and you can see on that it's usually between T5 and T7, usually T5, T6 range. So you can see by the markings here, you can count these ribs down. You can see the first rib back around here, second rib, third rib, fourth, fifth, sixth, seventh. You can see these ribs correspond with the vertebrae. So if you count those down, then you can approximate where the carina is and make sure your endotracheal tube is up above it. And you can also look at the window right here. This is usually corresponds to where the carina is as well. Let me get rid of those markings. So here is a normal chest x-ray, and if you do the method A for airway, you can see the airway coming down here, the trachea. My pen would work. And here's the carina right here. And obviously you're going to want either your line coming down here, somewhere right about the carina, or your endotracheal tube about 5 centimeters above the carina. And I usually put it, right below the clavicles. And again, you can look at the window here to also judge where the carina is if you're having a difficult time, if the x-ray is poor for whatever reason. But B for bones, go through and check all the bones out. C for cardiac silhouette, here's a cardiac silhouette. D for diaphragms, you can see the diaphragms here, and they're fine. E for everything else, gastric bubble. You can see that the lung markings, vascular markings, go all the way out. So there's no pneumothorax. You don't see any lines, tubes, etc. here, so this is just a normal chest x-ray. And there we go. So here is a chest x-ray with some various things going on. And start with A, come to the airway. Here's the trachea. See, it comes down here. Here's the carina. And you can see there's something in this airway coming down here. There's an endotracheal tube stopping right there. It's right about the clavicle, so it looks like this is about 5 centimeters. So that's good placement of the endotracheal tube. B for bones, check out all the bones, they're fine. C for cardiac silhouette, you can see the cardiac silhouette here. It looks good. D for diaphragms here, E for everything else. We found the one line already. You can see the EKG lines here, but that's obviously not important. The vascular markings go all the way out to the periphery. So there's no pneumothorax. Both lungs are inflated. You can see some oxygen tubing up here. Again, that's not important. Just so you're aware of what it is, in case some of your novices are reading chest x-rays, you're not wondering what the heck it is. So this is appropriate placement of endotracheal tube here. And another x-ray, starting off with A. Here's your trachea coming down, and it looks like it's going to be difficult to pick out the carina on this one. So you can look at the window, just a quick dirty method. So the carina should be right about here. And you can also count down. You can see the first rib here. Here's second rib, third. Looks like fourth, fifth, sixth, seventh. Let's see here. 1, 2, 3, 4, 5, 6, 7. So the carina is going to be somewhere between here. So with this window being here, I would bet the carina is right about here. So that tube could probably be pulled back just a little bit. It is either really close to the carina or 1 to 3 centimeters above the carina. In any case, I would probably pull it back to about right here. If I get my pen to work, there we go. Let me clear those markings so we can see it better. So we found the tube. Then let's go on to B. B for bones. So we look at the bones. I don't see any fractures. C for cardiac silhouette. You can see the silhouette left side here. Right side is kind of obscured. D for diaphragms. Here looks like part of the diaphragm is kind of obscured here. So again, that's called the silhouette sign. And left diaphragm over here. E for everything else. Well, you can see there's a few other things going on here. One has a ground glass appearance, so this is probably a COVID patient. And you can see that it's obscuring the right side of the heart as well as part of the diaphragm there. And you can see a couple other lines. You can see this line here, ending, looks like right below the carina, which is good placement. And you can also see what looks to be an NG tube coming down here, and then over here. So it looks like it's can't really see in here, but it looks like it's probably proper placed on the stomach, although that is cut off down below there, so it makes it difficult to tell. So lung markings go all the way out to the periphery, and that's it in a nutshell for this chest x-ray. So pull that ET tube back just a little bit. It looks like the NG is appropriately placed, and this line is what it appears to be, although I don't see a port here, so I'm not quite sure. Maybe an old one, who knows? That's radiologist territory there. On to the next. So another line here, and you can see let's start A for airway. This is a nice chest x-ray here coming down. You can see the carina right there. And nothing in the trachea. B for bones. Bones all look okay. C for cardiac silhouette. D for diaphragms. And E for everything else. You can see good lung markings all the way at the periphery, so no pneumothoraxes. And you can see a line here. And my guess it's probably a PICC line, could be a subclavian. It stays below the clavicle and then comes down and terminates right here. So it's just below the carina, which is fine. And for short-term placement, you want the tip at or just below the carina. You want to make sure that the catheter is vertical and not coming in up against the vessel wall, which could cause complications. If it's long-term, down a little bit deeper, cavo-atrial junction would be appropriate. But I'm perfectly happy with that placement, which again is right here. And another one here, A for airway, another nice x-ray. Coming down here, you can see the carina right there. B for bones, what bones you can see are fine. C for cardiac silhouette, well, you can only see part of it. So we'll just do the line placement here. You can see where the carina is, and this line comes here. It stays below the clavicle and then terminates right there. So just right above the carina, and this is probably a subclavian line. I would be happy with that placement, short-term placement. Again, if it's long-term, you probably want it down a little lower, down around the cavo-atrial junction area. But I'm happy with that placement. This vertical, or this end is vertical again. You want to make sure that that's not abutting a vessel wall, and usually get it when it comes across from the patient's left side before it makes a turn. And here's another one, A for airway. Come down here. It looks like the carina is right here. And B for bones. Looks like the bones are all okay. C, cardiac silhouette here. D for diaphragms. And E for everything else. Good lung markings all the way at the periphery. Good lung markings. And you can see that there is a line here. Looks like an IJ coming down. Looks like it ends right about there. So it's ending just above the carina. And probably could go a little deeper, but depending on what you're using it for. And oh, I just noticed this is one I placed. So yeah, that's perfect placement. So this just a hair high, but for short-term placement, which is, if I did it, that's what it would be for. And I'm sure I'm transferring this patient out because I work at rural hospitals. I'm happy with that placement. Yeah, some of these images are mine, some I found on the internet. And another chest, A for airway. It's very difficult to see on this one. You kind of see the trachea coming down, then lose it. You can see the window right here, so most likely the carina is somewhere right around here. You can see the first rib here, second rib, third rib, fourth, fifth, sixth, seventh. So this is sixth, seventh, saying the carina is probably somewhere in here. So this first area is probably a little low. We can get rid of those markings so we can see. So you can see cardiac silhouette looks normal, D for diaphragms, and E for everything else, good lung markings all the way out. And then this line that comes here and ends right there. So looks like it's probably just at the carina, which is good placement. You can see the tip is oriented vertically, which is good. It's not abutting the walls like if it came across and was up against a wall if it's a little high. So this is good placement. And another one, A for airway. Here's the trachea coming down. Kind of difficult to see again. So let's count. Looks like first rib, second rib, third, fourth, fifth, sixth, seventh. Did I count that right? He's kind of twisted, so it makes it a little more difficult. Let's try it again. So it looks like here's first rib. Looks like second, third, fourth, fifth, sixth, seventh. Yeah, so the carina should be somewhere in this area. although it's going to be a moot point anyway in this particular case. So B for bones, bones are okay. C for cardiac silhouette. Again, he's twisted, and you can see by these clavicles coming here that he's really twisted. So that's going to move that heart to where it looks like it's more on the right-hand side, but it's not. Has a big gastric bubble. D for diaphragms down here. You can see that big gastric bubble down there. So he does have a line, and it's coming here. It's probably a PICC line, but it made a turn and it went up into his neck. So obviously that's misplaced. They're going to have to, depending on what, if they're done or still sterile, etc., either back that out or replace it altogether, back it out and re-advance, or replace altogether. So, yep, that needs to be dealt with. All right, here is a chest x-ray. A for airways, come down here, look at the carina is right about there. And I see something, a line here coming down here that appears to be in the trachea, and then goes down into the right lung. So it looks like that's an NG tube that's misplaced. Looks like they have it in the trachea instead of the esophagus. This here is just an oxygen tubing here, so you can ignore that. But this line obviously is not good. They did a good job getting that way down in that lung, though. I'm not quite sure how, but kudos to them for effort. And get this working here. All right. So, another chest x-ray. Trachea, A for airway, come down here. Looks like this is probably the carina right about there. You can see there's something in the airway. Looks to be an endotracheal tube ending right about here. B for bones. Bones look okay. Cardiac silhouette. D for diaphragms. E for everything else. Looks like they have good lung markings all the way out. Looks to be a little fluffy down here. That endotracheal tube looks to be probably about 3 centimeters above the carina. So I would be happy with that placement there. Lungs are fully aerated. So endotracheal tube with appropriate placement. And another chest here. This is an interesting one. This is one of mine that I had. I believe, if I remember right, this one is one that I did a thoracentesis on and drain. You can see, let me go back here. A for airway, coming down here. Here's a carina. Nothing in the trachea. And B for bones. Bones are okay, I believe. Let me look a little closer here. So I don't see anything. C for cardiac silhouette, you can see the right side okay, left side is obscured. And D for diaphragms, you can't see any diaphragms. Diaphragm on the right side here, you can see he has a pleural effusion. See this line going straight across, that's fluid. And the left side has a big pleural effusion. This is all fluid in here. And lung obviously is being pressured from that pleural effusion. And if I remember right, I took off like 1,300 cc's off this guy. And it just on the left side, the right side I didn't touch. And he did okay. Oops. But the pleural effusion is interesting here. And And another chest x-ray. You can see trachea here, carina. It looks like there's something in the trachea. Endotracheal tube ending about right there. And B for bones. Looks like bones are okay. C for cardiac silhouette. D for diaphragms. E for everything else. Looks like good lung markings all the way out. You can see lung markings all the way out on the right side too, but you can also see a lot of fluffiness in there. This looks like it may be a contusion. Again, I don't have this patient's history. You can also see a line coming right here. Let me clear those markings out first. The tip's a little more vertical, and to have it just below the carina there. So you have endotracheal tube, then this line here, that's probably a subclavian. And then of course this right lung not looking good. And here's another chest. You can see the trachea coming down, and it appears like this is carina, and it looks like there's something in the trachea, so this is an endotracheal tube ending right there. And so that's about probably 4 centimeters above. B for bones, look all the bones, and they look okay. Cardiac silhouette, good luck with that, you can't hardly see it. Diaphragms, you can maybe kind of sort of, I don't know, this is rib here, I can't even really pick out the diaphragms. So looks like this patient's not doing well, obviously. A lot of fluffiness going on in there, so ARDS, pulmonary edema, something's going on, but he's intubated and has a line here as well. But it ends right there, so it looks like a left IJ, but it needs to be advanced further, so it needs to make this curve and come below, at or below the carina, at least down to here. So I would want that IJ advanced a little bit more. Endotracheal tube is appropriately placed. And on to some pneumothoraxes. So here we have airway, carina. Airway's clear, I don't see anything in there. And B for bones, I don't see much in the ribs. C for cardiac silhouette, heart looks good. D for diaphragms. So this diaphragm here goes really deep on this side. You can see this right here. And you can see that it's a supine film. So this is what's called a deep sulcus sign, and that's indicative of a pneumothorax. You see it in supine patients. If you put this patient upright, you'd probably see a normal classic pneumothorax. And again, you can pop the ultrasound on this and pick it up much easier than with the chest x-ray, as the ultrasound is much more sensitive and specific for pneumothoraxes. But this is a deep sulcus sign and means that there's most likely a pneumothorax. You can also, if you can't raise them up and you're unsure, don't have ultrasound, whatever, you could do a expiratory film that would show that much better as well. All right. Trachea. Looks like carina is probably right about here. And I don't see anything in the trachea. B for bones. So patient's right side looks okay. Patient's left side. I don't see much here. To get my pen working. Except right here looks like there's a fracture. See that right there? Kind of subtle and hard to see. I almost missed it. But you can see the bone right here and that step off. Let me clear those markings again. So that looks like this is first rib, this is second rib, so that's probably third rib. So he definitely has a fractured rib there. This here I don't think is a fracture. It looks pretty smooth coming in here and going over, so I really don't think that's a fracture. But this one here, is that... It could be clavicle too, now that I'm looking at it. But he's got something going on there. And chest x-rays are notoriously bad for picking up rib fractures. But in any case, C for cardiac silhouette, heart looks fine. D for diaphragms, this diaphragm looks all right. This diaphragm here, though, you can't see. Straight line over here. Looks like he has a pleural effusion. This is gastric bubble, of course. D for everything else. Periphery, lung markings go all the way out on the right side. Patient's left side, though, this looks like breast tissue mucking things up in there too, so you need to be careful of that. And let's see if we can blow this up a little bit. There we go. So if you blow it up a little bit, you can see that the patient's missing some lung markings. You can see that there's really no lung markings out here. And you can see the pleura right here. That's pleura coming down here. And you can see here there's no lung markings. So this is a pretty good sized pneumothorax, and patient is going to need a chest tube for that for sure. And of course I imagine this pleural effusion down here is blood. So I would bet that this is a trauma patient, and more than likely, seeing this fracture up here, yeah, you know, no more that I look at it, that's a clavicle. What am I thinking? You can see the clavicle right there. Here's one end of the clavicle, and here's the other end of the clavicle. So yeah, that's a clavicle fracture, then the ribs are behind it. But it still looks like there may be a fracture here in this rib. So it looks like a clavicle fracture, and then maybe a fractured rib right there, which looks to be either the second or third. I think it's probably the third. I think this is second here, second rib. So anyway, this patient obviously had some trauma. I don't see any other, but not to say that they're not there, of course. That's an interesting film, though. All right, another chest x-ray here. This iPad would cooperate. So trachea coming down here, looks like the carina is right about there. And I don't see anything in the trachea. B for bones. Start on the patient's right here. I don't see any fractures. Patient's left. I don't see any. C for cardiac silhouette, can't see the right side. D for diaphragms. This diaphragm looks okay, gastric bubble. This diaphragm over here you can see has a pleural effusion going on. This is probably diaphragm here, but definitely has fluid in there. E for everything else. Looks like lung markings going all the way out on the patient's left. The right side looks like it's missing some markings down here. Let me blow this up a little bit. Okay, so you can see no lung markings in here. And you can see the pleura coming right down here. So this patient has a pneumothorax. And up here you can see he's missing, look at the difference between this side with the lung markings and this side with no lung markings. And you can see the pleura looks like right here. So this patient has a pneumothorax. And of course we have a pacemaker here. And the pacemaker leads coming down here, one ending in the right atrium and the other coming down here. So, yep, I would read that as pneumothorax. Just a minute, somebody knocking at the door. All right, sorry about that, and I am back. And on to the next film. If I can get this thing to work. For some reason it's being obstinate. There we go. So another chest x-ray, and here is trachea. Here's carina, my pen will work. Nothing in the trachea. B for bones. Bones appear to be okay. Here's this left side. C for cardiac silhouette. D for diaphragms. This film's kind of cut off a bit. Sorry about that. And E for everything else. We know there's something on this right side. Let's go left side just to make sure it's okay. It looks like lung markings all the way out. But here on the patient's right side, you can see a chest tube here. And if you blow this up so you can see lung markings here on the patient's left. But the right side is totally devoid up here of any lung markings. And you can see the pleura right here. So although this patient has a chest tube, it's not fixed that pneumothorax yet. That lung's not expanded. So something is going on, either the tube is plugged, or maybe the holes are outside the body down here, or something. Excuse me. So this needs to be fixed or replaced. And that patient still has a pretty good sized pneumothorax going on. And chest x-ray, A for airway, trachea coming down here. Carina looks about right there. But it looks like this is shifted over a little bit. You can see here's what looks to be midline coming down here. You can kind of see it shifted to the patient's right a bit. So B for bones, the patient's right side. Ribs look okay, clavicle looks okay. Patient's left side, though, looks to be a mess. Looks like there's probably, since this is cut off, but it's probably a clavicle fracture up there. And you can see, let's blow this up a little bit here. You can see down here, just glancing, a bunch of subcutaneous emphysema there. And these ribs down here probably have some fractures, although it's hard to pick them out individually. There's so much junk down there. And some subcutaneous emphysema up here too. So that's all air. So cardiac silhouette. This is probably the right side of the heart here, if my pen would work. Can't see the left. And you can see that the whole heart is shifted over as well. D for diaphragms. Here's diaphragm. You can't see diaphragm here, but you can see fluid, pleural effusion. And E for everything else. Patient's right lung looks to be expanded, good lung markings. Left lung, though, you see there's no lung markings, so it has pneumothorax. It shifted everything over, so it tells you it's a tension pneumothorax. And they probably should have picked this up before this chest x-ray, but I would imagine he's starting to show signs clinically. But he obviously needs a finger thoracostomy and a chest tube, or a needle thoracostomy if you don't do chest tubes. And interesting x-ray though. And another, looking for the trachea here, but it's a bit underexposed. You can't really see much. I don't see really anything there. So B for bones, what you can see, I don't see much fractures there. And cardiac silhouette, here's the silhouette. You can't really see anything here on the patient's right side. Diaphragms, and you can see this deep sulcus sign again, telling you there's pneumothorax. But even without that, when you look at everything else, you can see that there's no lung markings in here at all, just at a glance. You can see the pleura right here. That's lung. My pen would work. The left side, lung markings all the way out, but the lung is pretty compressed. This diaphragm is elevated. This diaphragm is compressed. Things are shifted. So this is a tension pneumothorax as well. And now that I'm looking, you know what? I think I see, this might be a bronchus, maybe carina in here, maybe trachea. But anyway, it's really shifted, and this patient needs to be fixed to PDQ. Chest x-ray, here's carina. I'm sorry, trachea coming down. Can't really pick out the carina, but if you look at the window here, so it's probably somewhere in this area. Let's count, if we can, look like first rib up here. This is probably second, third, fourth. My pen would work. Fifth, sixth, seventh. So the carina is probably going to be right in this area, but I don't see anything in that trachea anyway. B for bones. Patient's right side, don't see much. Patient's left side, looks like he has a fractured clavicle up here. You can see that. And as far as ribs go, I don't see much going on with his ribs. Cardiac silhouette. Diaphragms, you can see this diaphragm you can't see has a pleural effusion, gastric bubble. You can see that layer of fluid there. It's probably blood. Again, I don't have any history on this particular one, but he definitely has a fractured clavicle up there, and may have a fractured rib back there as well. So if that happened, that's a lot of force to break that rib up there. So E for everything else, you can see good lung markings on the right. Again, if my pen would work. But on the left here, looks like there's some issues. I don't see any lung markings down here. Let's blow this up a bit. That's better. Don't see any lung markings up here. Come on, pen. And you can see a pleural line right here. Looks like this is probably pleura. So this patient has a pretty good sized pneumothorax. I just want to peek at these ribs again up here. Looks like it might be one right there. So yeah, this patient needs to be fixed. Needs a chest tube. And another chest. Here is trachea coming down. Actually, it looks like it's coming down here. Looks like this is carina. This is aortic knob. So things, I already tell things are really shifted. And you can obviously look at this and say, man, this guy's got a lot going on. But I'm deliberately not mentioning that until we go through the systematic way of reading these, just so you don't miss anything. So you can see there's nothing in the trachea. B for bones. Look on the patient's right side, ribs look okay. Look on the patient's left. I don't see anything. This here is not a fracture. Okay, C for cardiac silhouette. You can see it's really shifted. D for diaphragms. You can't see the whole thing, sadly. But you can see there's probably going to be deep sulcus over here. You don't see any lung markings. You can see a pleural line here. That's the lung. Good lung markings out here, so that's good. So this patient has a tension pneumothorax, and again needs finger thoracostomy followed by chest tube, or if you don't do chest tubes, do a needle. I tend to go right to a finger thoracostomy. It's quick, 100% effective, and you can do a chest tube anyway. If you don't do chest tubes, and you can consider needle thoracostomy, and do the anterior placement now, and the axillary placement now instead of the anterior placement, as it is more effective. And just a few miscellaneous slides here that are interesting. This one here, A for airway, there's a carina, nothing in the trachea. B for bones, bones look okay. C for cardiac silhouette, looks all right. And D for diaphragm, so here's a diaphragm and here's a diaphragm, but there's air underneath the diaphragm. So this patient has a pneumoperitoneum, air in the abdomen, needs a general surgeon to fix him. That's an interesting one, thought I would include. And again, A for airway coming down, here's carina, trachea is clear. B for bones, bones look okay. C for cardiac silhouette. D for diaphragms. And this one here, you can see air under the diaphragm. This patient also has, this is a gastric bubble. This patient also has pneumoperitoneum. You can see some air over here too. Needs a general surgeon to fix him. And a few pleural effusions. This is a patient of mine, I can tell. Came in with a big left-sided pleural effusion, small right side. So here's trachea coming down here. Looks like this is carina. Trachea is clear. B for bones, no fractures. Cardiac silhouette, you can see the right. Can't see the left side of the heart because of that big pleural effusion. Diaphragms, looks like it's a small right pleural effusion. You see how flat that is. And a big, massive left pleural effusion. And this guy did a thoracentesis on, and I don't remember how much I took out, but I'm pretty sure it was a large amount. And here's another one. I can tell it's my patient. I seem to get these with my black cloud. And trachea coming down. Looks like the carina is probably right in this area. Bones look okay. Cardiac silhouette, you can't see much at all here. Diaphragms, here's right diaphragm, can't see left diaphragm. You see gastric bubble down here. Good airway markings. On this side, airway markings up there, but you can see there's a big pleural effusion here. And this guy, I remember, he had was actually doing pretty well, and this was old. He had started having problems a couple of weeks prior, and had fallen. Let me go back to bones here. So we skip the bones, make sure it's the right patient. So ribs on this side look okay, but the ribs here come down. So you can see a fracture here, fracture there, fracture there, fracture there, fracture there. So 1, 2, 3, 4, 5 rib fractures there. Looks like 1, 2, 3, 4, starting with the 5th rib, 5th through 9th. So this is blood in here. And he obviously needed a chest tube and got shipped out. And this patient here, A for airway, carina, B for bones, ribs. Ribs on the left side look okay. Cardiac silhouette, can't see it here because of big pleural effusion. Diaphragms, can't see it as well for the pleural effusion. Right side has a small pleural effusion, left side has a large pleural effusion. So this patient needs a thoracentesis. All right, and a couple of interesting sites for ultrasound podcasts there. If you're interested in ultrasound podcasts, podcast.com, 5minutesauna.com. They have a bunch of sites for x-rays. Radiopedia is excellent. They have a bunch of courses, a bunch of podcasts, and just general podcasts you can find on YouTube are very good as well. So I hope you enjoyed this. Until next time.